Hi, Cheri Thompson here again. I'm the nurse injector at Lawrence Plastic Surgery. If you've been watching our virtual open house, you saw me earlier inject my patient Steph in the glabella area. And we talked about how Botox works and how it relaxes those muscles so you don't make that strong a contraction. The glabella area, which I injected on Steph, is here. If you'll frown for me, Cindy. Yeah. It's there, and it's a very common area for us to inject. Having said that, I inject lots of times on the laugh lines, or crow's feet, which is on either side of your eye. When you smile up, you can go ahead and, it's this area here. And also, we're going to put a little bit in Cindy's forehead, which is the frontalis muscle. If you'll lift your eyebrows up, so here. Sometimes when we used to do Botox, when we first started quite a while ago, we kind of followed every line. But Dr. Thellman has instructed us to, if you can almost make just a V, it spreads about 1 centimeter, so we don't have to use as much Botox, and that's more economical for the patient as well. So we're going to lay Cindy back, and I'll mark her like I do every patient, and then we'll inject. Okay, Cindy laying back here a little bit. I'm going to put it down just a little bit more. And we'll just wash the area off. Cindy has had Botox before, and my first patient, Steph, has not. So if you bring your eyebrows up, so we'll just kind of mark here, here, and here. And that'll take care of a lot of these lines, which she doesn't have that many to start with. And then if you'll turn this way and smile up for me, okay? You can relax. I'll just do about 3 injections here. Each injection is in an increment of 2.5 units. So here, this forehead is 7.5 units, as well as the laugh lines. Smile up. Okay, you can relax. Okay. I like to use a little cool pack here. It just makes it feel a little better for the patient. And it also kind of restricts that blood flow a little bit so that you may have a little less chance of bruising.
How often do you see bruising?
I don't see bruising very often. You know, you can see vessels, big stick here, and avoid those. But sometimes there's little capillaries down beneath the skin that you can't see, or sometimes the patient is not able to get off their blood thinner, big stick here, as far as like a baby aspirin or something that their doctor has prescribed for them. So those patients may have a little bit more chance of bruising, but having said that, even patients that are on that small dose, I don't see much bruising. We use a very fine needle. Okay, big stick. So that's it for the frontalis area. We'll just hold a little bit of pressure and give her a little break. You know, it's quite a few sticks. I mean, she'll have 3 on this side, 3 here, and 3 here. But having said that, the needles are small, and I think the cool packs help. Are you doing okay, Cindy?
Absolutely.
Okay, I'll have you turn your head that way just a bit. That's perfect. You'll see these bumps here. She kind of looks like a Klingon.
Great.
Those will dissipate. That's just fluid there that will dissipate. They won't last more than about 15 or 20 minutes. So we'll get started here. This muscle is called the orbicularis oculi, and you'll feel a stick here. It is really just under the skin. There's not much wiggle room on this one. It's a nice result though. You can still smile just like you did before, big stick. It doesn't paralyze, the smile factor. It just relaxes those lines. Big stick. These little ones down by the cheek kind of hurt a little more than the others, but it's not.
They don't hurt at all.
Thank you. Did you hear that, everyone? They don't hurt at all. Okay, we'll move to this side.
You're good, Cheri, you're good.
Even my needles don't hurt. Okay, we'll just start on this side now. Big stick. Two more, Cindy. Big stick. And the last one. I guess I do want to comment on, COVID, and you can see that on most injections on all the injections I've done today, my patient was able to keep their mask on. There's no reason to take it off at this point, unless I'm doing something around her mouth, and of course, but we just try to use every single precaution we can during these times. I'm going to back up right here. And I want you to not work out today or tomorrow. She's kind of a gym rat, so she's working out a lot. And, just like we talked about before, we want that Botox to stay right where I injected it. We don't want to increase blood pressure or swirl around where it's not supposed to be. I kind of call it in limbo, because it takes, I don't know how long it takes yours to set up. Maybe a week or about a week, yeah. And some people it takes a little longer, some people 3 to 5 days. So, and that's why we tailor it to you. It's not just a cookie cutter amount of Botox or where we should put it. That's why I like to see my patients initially for a consultation, so we're on the same page as what their activities are going to be. I always tell my patients, let's not get injected the day before prom. So, so thank you for coming in, Cindy, and give me a call with any questions or concerns, and it's always nice to see you.
Well, you are the best there is with this type of work.
Thank you, Cindy.